Professor Bala Venkatesh. Professor, you talked about the study that you've been working on was designed to examine the impact of COVID-19 from the perspective of the healthcare workforce, which is really important, and on preventing the infection. Noting that this work commenced before the vaccine was produced, can you give us an update on your research and tell us about the impact of COVID-19 in India, where it was one of your major sites?
Thank you, Professor Fleming, and I would like to start by acknowledging Wesley Medical Research and all the donors who allow us to do this work. Before I answer your question specifically, I just want to give you a perspective of what COVID is in resource-limited settings. So there have been 32 million confirmed cases in India, and the real estimate is somewhere between 300 to 400 million infections. That's the real estimate in India, but they don't have the same testing capabilities as we do. And it's also important when we report research that there has to be global generalizability of any research findings. So research conducted in healthcare systems like ours, where it's well-resourced, the same results may not be valid if it's conducted in a resource-limited setting, because their healthcare approaches are different. Access to healthcare are different. So what the Wesley Medical Research support allowed us to do was, in fact, gave us a platform to study 4 different questions, which was very critical. And I will go through one by one. The first one was looking at the question of hydroxychloroquine, which was very topical very early in the piece during COVID-19, and both as a preventer and as a treatment for COVID-19 infection. And we tested healthcare workers in India. Our plan was to enroll 8,000 healthcare workers, and it was very difficult to do that for a variety of reasons, which I'll allude to later on. But we ended up having to stop the trial after 450 healthcare workers were enrolled. And interestingly, just to put things into perspective, at the same time as Wesley Medical Research supported our work, there were 2 other international trials of hydroxychloroquine, one by federal government funded from here with a budget of $3 million in Melbourne, and a University of Oxford trial, which was also well funded. And they managed to enroll, with such extensive funding support, they only enrolled 270 healthcare workers from Melbourne and 220 from Oxford. So it just tells you the challenges that people had in trying to enroll into this particular study. But importantly, what we showed was that although it was not, it didn't have the statistical power to show the results, we showed that the healthcare, the COVID-19 infection rate in healthcare workers is about 5%, and hydroxychloroquine did not have an effect as we would expect. And we also examined the role of the BCG vaccine, because that was thought to be a protective in some stages of COVID. So we tested that as well, and it did not have any effect on COVID-19 development. We then had a platform at the same time. This platform helped us to study a second question, which was looking at corticosteroids. Steroids are a group of drugs which have been tested in COVID-19, and the only drug which has been shown to be effective in COVID. And the UK group identified this, and they tested a dose of 6 milligrams in their cohort. So we did a large randomized controlled trial in India and in Europe, looking at comparing 6 milligrams versus 12 milligrams. And again, I want to emphasize that the platform that we had with the hydroxychloroquine study helped us to develop this collaboration. We enrolled 1,000 patients, and we showed that 12 milligram was actually better than 6 milligrams. And in fact, for every 20 patients that we treat with 12 milligrams, we save 1 life. So the results are now being reviewed by a high-impact journal and will be in the public domain very soon. The third trial was the ASCOT trial, again, what's called the Australasian COVID-19 trial, which was funded by the federal government, as well as I think the Wesley Medical Research were also very keen to support this at the time. And they could not enroll many patients in Australia because there was not a high COVID load. And They came to us through the George Institute, and we have enrolled 900 patients, and the trial is still continuing and going well. And finally, we also tested the proof of principle of a 3D printed mask, an oxygen delivery device, because ventilators are in short supply, and particularly in resource-limited settings. And so we just want to test whether this would reduce the need for requiring a mechanical ventilation device. And we again used the same platform of our collaboration, and we did a proof of principle study. And even in that small study, there was a big difference in the requirement for mechanical ventilation. And therefore, we are going for a definitive larger trial. So, yes, so I think these trials have been very important, and particularly doing them in resource-limited settings have that level of generalizability, which adds to the robustness of all these results.
Yeah, thank you very much. As many of us would have seen on television, the Indian COVID experience has been a dreadful one for people who come from a country like Australia with every resource and every opportunity. So it's a marvellous thing that you're doing to be working in that context where it is really resource starved. Thank you very much.